So, by now, I'm sure that you all have heard of the untimely passing of this beautiful and amazing influencer, Jessica Pettway, due to cervical cancer. She passed from cervical cancer, but she was misdiagnosed with fibroids prior to this. And I think now is a great time for us to have a little discussion. So, I want you guys to hold on for a second. Okay, so I want to have a discussion on womb health. Okay, I want us to talk about knowing our bodies, what it feels like when we are feeling great in our bodies, healthy, and what is normal and what is abnormal in our bodies. And so, hey, my name is Darlene Johnson, and I am a womb wellness practitioner, yoni steam facilitator, herbalist, owner of Her Secret Garden, which is a feminine hygiene brand, plant-based feminine hygiene brand, and I am a postpartum doula. And so I want to have this great conversation, which I've been having in my community for years and years and years, just about knowing yourself and what your baselines are. Before I started Her Secret Garden product line, there was Her Secret Garden V Steam, as in vaginal steam. I used to have a yoni steam business. And when you came in and you got your yoni steam, on the intake form, I would always ask, do you track your period? And the reason why is because as women, it is extremely, extremely important for us to know our bodies and to know what is normal in our body and what is abnormal in our body. So, tracking your period is one piece in the bigger picture in women's healthcare or in your womb health, right? So, we have our period or menstruation, but we also have other phases that our bodies go through throughout the month that will tell us about where our hormones lie, what's going on, what's abnormal, what's normal, right? So we have our follicular stage, we have our ovulatory stage, we have our luteal phase, and then we have our period or menstruation, which is when you actually bleed. Now, these are so important, like I said, because there's different hormones being released at different times of the month. And so if anything goes awry, if you all of a sudden don't feel good, if you are getting infections, yeast infections, bacterial infections at the same time every month, this is going to give you the information that you need to give to your doctor so that they can better treat you. So, for example, your period comes every 27 days. It is not heavy. It lasts and you bleed 5 to 6 days and then you're done, right? So, for the last 2 months, your period has been coming every 24 days and you've been having extremely heavy bleeding with blood clots. In this case, this would be something that you would want to definitely say, hey, doc, this isn't normal for me and I need some assistance in figuring out what's going on with my body. So when we have the baseline and we know exactly what's normal, period comes every 28 days, period comes every 27 to 29 days. It's a normal period. We bleed for 5 to 6 days, 7 to 8 days. There's no heaviness, or there is a lot of heavy bleeding and blood clots, and that's totally normal, and that's your baseline. We all have different baselines, but it's very important for you to know yours. Also, advocating for yourself. If you know in your body, if you feel your body is off, and I'm speaking from the point of view, I'm a 46-year-old woman. I have fibroids. I've dealt with fibroids for the last 10 to 12 years, and I've also had several abnormal pap smears. So when you have an abnormal pap, they usually have you come in, I think it's between 3 and 6 months to get retested. And then if you have so many abnormal paps, then they'll do a procedure which is called a colposcopy, where they actually take a chunk out of your cervix so that they can put it under the microscope and really see what's going on and why you're having these abnormal paps. Well, one of the reasons that it's so important to know your baseline is so that you can advocate for yourself. Hey, this isn't normal. I'm having this pain. I've had this pain every single month on days 18 through 21, and I don't know what it is. So that your doctors can meet you and help you. And then also, if your doctor is not willing to help you, you can find someone who can and who wants to. Especially for my Black women, there's not enough empathy in the medical arena for us, not just in everyday patient OB contact, but also in childbirth. There's not enough empathy for us, right? There's a myth that Black women or Black people just in general have a higher pain tolerance. So oftentimes when we complain about pain, our pain is not taken serious. So that's why it's so important as a Black woman to be able to advocate for yourself in the doctor's office, in the hospital. If you know that this is not normal for you, if you know that you are not feeling normal in your body, advocate for yourself. Request the pap smears. I hear that you're only getting a pap smear every 3 years. I know I get mine every year because I've had the abnormal paps. My doctor will test me every single year, and she gives me a pap every single year. And I know that you can request it. I know it has a lot to do with insurance and different things like that. You can request a pap smear every year, and maybe you'll have to pay out of pocket. If your doctor denies you or is like, no, I'm not going to do it this year, you also want to make sure that they document that in your chart. So if they say, no, you don't need one, or I'm not going to do one, make sure you say, you know what, I want to make sure that you document that in our notes today, and then I need a copy of that I asked for a pap smear and you refused a pap smear, and I need a copy of that. And so making sure that we're advocating for ourselves, making sure that we know our baselines, making sure that we know what our bodies feel like when it's healthy and normal and we have all the vitamins and the nutrients that we need. And then when we're feeling off, making sure that we go to a doctor that's going to listen to what we have, listen to our concerns, and then make sure that we are getting the ultrasounds, the tests, the blood work, all the things to make sure that we are living healthy and long lives. So this is for my ladies. This is for my Black women. I love you. We have to take care of our womb health. We have to take care of our womb space. We have to heal the traumas that are associated with those areas as well. And I send this in all peace, love, and light.